startling facts about blood clots is that they can affect anyone, young or old, male or female, any race, those with several comorbidities, or those that are seemingly healthy. In fact, many celebrities have either died from or been affected by blood clots. And some of those people more recently have helped bring awareness to the forefront. A blood clot or thrombus is when blood pools together inappropriately to form a mass of coagulated blood. This typically occurs when something slows or changes the flow of blood in the veins. It can occur within the venous circulation, and when it forms in the deep veins of the body, most commonly in the leg, it is called a deep vein thrombosis or DVT. If a piece of the clot or the entire clot breaks off and travels through the vein to the lungs, it is called a pulmonary embolism or PE. This can block some or all of the blood supply to the lungs and can be fatal. Together, DVT and PE are known as venous thromboembolism or VTE, and together they are a leading cause of death and disability worldwide. As we've learned, blood clots can affect anyone. However, we do see them more frequently in those patients who have undergone multiple trauma, major surgery, are immobile for an extended period of time, or have a hypercoagulable disorder which may predispose them to blood clots. There are several other risk factors that do increase patients' risk of developing blood clots. Certain risk factors may increase your risk of developing a venous blood clot. Those major risk factors include having major surgery or trauma within the past month. The most common surgeries associated with venous thromboembolism include orthopedic surgery or hip and knee surgery. Reduced mobility, typically 3 days or more, often due to hospitalizations or bed rest. Advanced age, previous history of venous thromboembolism, either a DVT or PE, or family history. Inherited or acquired blood conditions such as thrombophilias, including factor V Leiden, antiphospholipid syndrome, antithrombin 3 deficiency, or protein C deficiency. Malignancy, or if a patient's on cancer treatment such as chemotherapy. Estrogen-based hormone therapy, including birth control or postmenopausal hormone therapies. Obesity, typically a BMI greater than 30. Women who are pregnant or just had a baby are at greater risk of developing blood clots. And smoking. Although a single risk factor may not result in venous thromboembolism or a blood clot, the risk factors are cumulative, so a combination of 2 or more may further increase patients' risk.
During that period of time when I had this DVT, I was in an airplane sitting on a tarmac in the middle seat for 5 hours without getting up, which is probably the worst thing you can do, either as a risk factor for getting a blood clot, and especially if you already have one, which I wasn't aware of. After going to a hematologist and going through a series of sophisticated blood tests, I found that I had a condition I was totally unaware of, which gives my blood a tendency to clot. And some of it was genetic, some was not.
After I was admitted to the hospital, I was diagnosed with antiphospholipid syndrome, or APS, which is a clotting condition that causes my blood to clot when it shouldn't, and it's a risk factor for blood clots. I was also taking estrogen-based birth control at the time, which is a risk factor for blood clots. The only thing is, I didn't know I had either of these risk factors.
That because of my previous cancer surgery, I am at risk for blood clots, and I've now had 3, and they just don't want to take any chances.
A DVT typically affects the large veins in the lower leg and thigh, almost always on one side of the body. Since the blood clot can block blood flow, warning signs that may suggest a DVT include leg pain or tenderness, especially in the calf, leg swelling, the skin of the leg feeling warm to touch, or redness or changes in skin color. A pulmonary embolism, or PE, can be asymptomatic, but a third of the time it can be fatal, and symptoms can be nonspecific. So any acute onset of shortness of breath, chest pain, cough, wheezing, rapid breathing, or bloody sputum warrants seeking medical attention to rule out a PE. Overall, symptoms for VTE can be subtle or nonspecific, so it's very important to be aware of the signs and symptoms of DVT and PE and be aware of its potential.
About 10 years ago, I got a pain in my calf, which was not terribly serious, so I basically ignored it. My wife, who had some medical knowledge, although she's not a healthcare professional, told me that I had a blood clot, and I actually totally ignored her as well because it wasn't bothering me very much, and I had very little knowledge of what DVTs or blood clots were.
I went for a run one day, and when I came back, I had really bad pain behind my left knee. I thought I had pulled a muscle. The pain got worse over the next day to the point where I couldn't walk on it very well, and I couldn't go up and down the stairs. I woke up the next morning with really bad pain in my left side that felt like somebody was stabbing me between the ribs with a knife. That pain also got worse and worse and worse as the weekend went on. I was having trouble breathing and I couldn't speak in full sentences. It was especially bad when I tried to lay down and sleep. I still didn't think anything was wrong though, but my family was becoming increasingly concerned about me, so they called my doctor, who called me and said, given that I had pain in my leg and my lung, he was really concerned I had a blood clot. He told me to go to the nearest emergency room right away because he believed my life could be in danger. With the blood clot in my leg, I had pain that started behind my knee and extended down my leg to my ankle. It was pain that only got worse. It didn't get any better with resting, elevation, ice. It just got worse and worse and worse. With the pain in my lung, it felt like someone was stabbing me between the ribs, and it was pain that got worse when I took a deep breath or when I tried to lay down. It was also pain that wouldn't go away.
My leg began to hurt more and more. The leg began to swell. Everything was very hot. I was excruciatingly uncomfortable. The pain became such that I couldn't believe that something more serious wasn't happening. And I also felt like this is something I couldn't ignore.
If you think you may have a blood clot, seek medical care immediately. The sooner the medical therapy can be started, the better, and it will prevent future potential complications. Imaging will most likely be done to confirm the presence of a clot. Depending on various circumstances, such as the location of the clot, the size of the clot, or other comorbidities you may either be treated in the hospital or at home with blood-thinning medications.
I called my physician. He told me to come over. He was near my office. I went into his office. He took one look at my leg and he said, "You have a DVT or a blood clot." You could tell by the swelling in my leg, which is one of the symptoms of the blood clot, which I hadn't noticed. I went right away over for a sonogram, which confirmed that I had a blood clot. I immediately went to the emergency room of the hospital. They didn't keep me overnight, but they started treating me right away with what they call an anticoagulant. Otherwise, people know it as a blood thinner. And that was something that was injected into me. It's something called low molecular weight heparin. And then they put me on an oral anticoagulant, which was a pill, and it's called Coumadin or warfarin. And they needed to get that in the right dosage so that my blood was a certain consistency so that I would prevent further blood clots.
This experience was the most terrifying experience I have ever been through in my life. Prior to my blood clot, I had never been in the hospital, and I had never experienced anything like this before. I was scared, I was uncertain of what was going to happen. I was in more pain than I had ever been in, and it wasn't going away. And maybe worst of all, I felt really alone. I felt really isolated. I thought I was the only younger person who had ever had a blood clot. I didn't understand what was happening, and it was absolutely terrifying. I was admitted to the ICU unit for 3 or 4 nights as doctors worked to stabilize my situation and control the damage that was done to my lungs and also my heart. From there, I was moved to a cardiac floor where I was monitored closely and began blood thinner treatments. I was there for several more days as I started to heal and adjusted to what had happened to me before I was discharged.
The diagnosis came in. I ended up having the doctor ask me a very strange question. He said, "Did you know that you had a blood clot prior to this?" And that's when I remembered that episode with the leg a few years earlier being red and hurting me, but going away in a few days. He said, "There's evidence that there has been a previous blood clot, and luckily for you, the blood was able to push the clot through and it didn't go anywhere dangerous." He said it was in your leg, very near the one we've discovered now. He said, "The one now, though, really concerns me, and what we will do is we will immediately treat it. But we need to get something into you very quickly." And I can't remember exactly what they gave me, but there were a number of shots. I think it's a very common treatment. And for a week, I had to administer shots into my stomach because he said, "We're going to be putting you on Coumadin, but Coumadin takes a while to get into the bloodstream."
The type of medications used to treat venous blood clots, such as DVT or PE, are called anticoagulants, sometimes known as blood thinners. They prevent the coagulation or clotting of your blood to form new clots or allow those current clots to get bigger, while your body works to dissolve the clot that already exists. They do not directly dissolve the blood clot that's formed. Other medications can do this, called fibrinolytics, which may be used in certain severe cases of clots. Anticoagulants are very common medications. In fact, over 2 million people take anticoagulants every day. There are several different types of anticoagulants, differing in their mechanism, route of administration, and other clinical factors such as the need for monitoring and how long it takes them to be eliminated from your body. They have all been shown to be very effective in treating venous thromboembolism. The choice of anticoagulant will depend on a number of individualized factors, and your healthcare provider will determine which one is right for you. For the treatment of venous clots, unfractionated heparin is typically given intravenously. Therefore, it's primarily used if you're admitted to the hospital. Low molecular weight heparins and fondaparinux are subcutaneous injections, a shot given just under the skin, typically in the abdomen. These can be used in the hospital setting or at home in certain circumstances, and if you or a caregiver is willing and able to inject. Majority of patients are placed on an oral anticoagulant for treatment. Warfarin was the oral anticoagulant available for venous thromboembolism treatment for nearly 50 years. However, in recent years, we have had several new oral anticoagulants emerge and prove to be as effective as warfarin therapy. These are referred to as DOACs, direct oral anticoagulants. They include rivaroxaban, apixaban, and edoxaban, which are classified as anti-10A inhibitors based on their mechanism, and then dabigatran, which is a direct thrombin inhibitor. There are several differences between warfarin and the direct oral anticoagulants, which you should be aware of to further discuss the selection of an oral anticoagulant with your healthcare provider. As we can see in this comparison chart, comparing warfarin to the direct oral anticoagulants, there are several differences. Warfarin does require frequent routine INR testing, which will determine the blood thinning effects. Direct oral anticoagulants at this time requires no routine monitoring. The dosing for warfarin is variable for each patient. The dose can often change depending on patient's clinical factors. The direct oral anticoagulants do utilize a fixed dose, which remains the same for each patient. Warfarin can be affected by various foods, particularly that include vitamin K. Vitamin K containing foods such as green leafy vegetables do influence the effects of warfarin. Therefore, patients on warfarin must work to maintain a consistent vitamin K intake in their diet. Direct oral anticoagulants have no interactions in terms of food. Drug interactions are fairly common with warfarin, as many drugs can influence its blood thinning effects. This requires more frequent INR testing and often dose adjustment in order to manage these drug interactions. The direct oral anticoagulants do have fewer drug interactions. However, as mentioned, there's no great way at this point to monitor for those drug interactions and to manage them. It does take warfarin at least 5 days to reach its full anticoagulant effects. The direct oral anticoagulants reach their full effects within 2 to 3 hours, which often alleviates the need for initial injections with a subcutaneous or with an IV anticoagulant. It takes warfarin 5 to 7 days to clear the body, and direct oral anticoagulants, if a patient has normal kidney function, will typically be cleared from the body within 1 to 2 days. In terms of reversal in emergent or excessive bleeding, there are proven reversal methods in terms of warfarin in the case of excessive bleeding. Direct oral anticoagulants have no antidote or reversal strategy at this point. Dabigatran and Pradaxa does have an antidote that was approved a few months ago, and the other direct oral anticoagulants, the anti-10A inhibitors, do have 2 antidotes or reversal options that are currently being tested and are at the FDA waiting approval. The cost of warfarin is very inexpensive, whereas the cost of the new direct oral anticoagulants can be expensive since they are relatively new to the market and brand name only. Now, in terms of effectiveness, they are both very effective in preventing recurrent clots. And for safety, they do have the same risk of major bleeding. However, studies have seen a higher risk of bleeding in the head with warfarin compared to head bleeds of direct oral anticoagulants, in which there's a lower risk. So again, agent selection should be patient specific, and these are several factors that you should think about and have discussions with your healthcare provider to determine which oral anticoagulant may be best for you.
Patients often ask, how long do I have to take this medication? The duration of time you will need to take an anticoagulant for depends on a number of factors your healthcare provider will review with you, including the location of the clot, risk factors that may have contributed to the clot, risk factors for developing future clots, how well you tolerate anticoagulants, and personal preference or lifestyle considerations. Treatment can be anywhere from short-term, which is 3 months, to longer-term, which may be 6 months to a lifetime.
And having to monitor my blood for the rest of my life is something that will affect my life. But I have been pretty stable on the warfarin, and so I've been pretty lucky about it. And I was really lucky in finding that I had this condition and was treated for it before it became serious.
Pretty early on, I had to come to terms with the fact that APS does require long-term treatment with anticoagulants. And in the beginning, that was really hard to understand, that I would be dealing with treatment, doctor's appointments, specialists, and monitoring of my blood for the rest of my life.
The only problem for me was that I had a particular perspective. I thought all of this treatment was going to be of a transitory nature, and that once they got rid of the blood clot, I wouldn't have to worry about it anymore. Subsequently, I ended up being put on Coumadin for 6 months. I said, that's really a long time, but the doctor said, I want to be on the conservative side. He said, probably after 6 months, maybe we'll take you off.
While on an anticoagulant, close monitoring and follow-up is key. Take your anticoagulant medication as instructed. If you often forget to take your medication, develop a daily routine to include taking the medication at the same time every day. Consider posting reminder notes around the house or use a calendar. Use pill boxes or pill organizers. Some even have timers that can alert you to the time to take your medication. There are alarm medication reminder watches available and several apps that are available for your phone or your other personal device. If on warfarin, record your doses on a calendar or chart, since they may often change and this can be confusing. Always keep open communication with your healthcare provider if there are any changes in your overall healthcare, disease states, or medications. Monitoring is imperative. If you are on warfarin, INR blood tests will be drawn to ensure that the thickness of your blood is in the desired range. INR draws will be more frequent when starting the medication. If on a direct oral anticoagulant, monitoring for kidney function will occur periodically. For all anticoagulants, we monitor for adherence or missed doses and for side effects. Maintaining appropriate anticoagulation is always a balance. Therefore, two major side effects that we monitor patients for on anticoagulants are bleeding and clotting.
The first side effect that we monitor is for bleeding. Since the medication is slowing down the clotting process, bleeding is a concern. Nuisance bleeding can often occur. This is bruising more easily, bleeding gums when flossing, short nosebleeds, or if you cut yourself shaving or otherwise, it may take longer to stop. But any severe bleeding, including blood when you go to the bathroom, vomiting or coughing up blood, severe bruising, prolonged nosebleeds that last longer than 10 minutes, difficulty breathing, chest pain, or any other severe or recurrent bleeding, it's recommended to seek medical attention immediately. You should also seek medical attention if you're involved in a major accident or experience a significant blow to the head. The second major side effect that we monitor for is at the other end of the spectrum, which is clotting. If the medication is not taken appropriately or is not effective, clotting may occur. So monitoring for signs and symptoms of DVT and PE that we discussed earlier are very important.
There are several tips to recommend to avoid bleeding when on an anticoagulant. Serious bleeding can be avoided by being cautious about high-risk activities such as contact sports or activities that increase your risk for injury. Always wear proper safety gear when working with tools or other higher risk activities. Wear shoes or non-skid slippers inside to avoid any falls. Nuisance bleeding can be avoided by wearing protective gloves when working with tools outside, being cautious with any knives, scissors, or razors, being careful trimming your hair and nails, use a soft toothbrush, wear shoes outside to avoid any minor cuts on your feet. And then, of course, always the appropriate monitoring that's recommended by your healthcare provider can help ensure that the anticoagulant is working effectively and minimizing the risk of bleeding.
Well, I took my Coumadin and I started living my life, but I wasn't particularly careful, and I gashed my leg, and it was a very small gash. This happened not too long after I started taking the Coumadin. And I gushed blood. Oh my gosh, I could not believe how traumatizing that was. There was blood everywhere. And when I wiped away the blood, it turned out to be a very minor gash. On the other hand, it was very difficult to get the blood to clot. And so I talked to my doctor, and he said, well, this is common, and I had to buy a number of things, such as wound seal, a stash of bandages, and I had to start being very, very careful about how I moved around, because I certainly didn't want to repeat that episode with the gash again.
Additional safety tips for patients on anticoagulant therapy include keeping open communication with providers that are managing your anticoagulants. Communicate any new medications, over-the-counter medications, herbals, or supplements that you may be starting or stopping. Communicate any procedures or surgery that will require temporary discontinuation. Do not stop your blood thinner unless directed to do so by your healthcare provider. Keep all phone numbers of your healthcare team handy, and this will help maintain the open communication necessary. Avoid missing a dose of the anticoagulant, particularly with the newer direct oral anticoagulants. If you miss a dose, the drug will not be effective. However, if you do miss a dose, do not double up on your next dose. Identify that you are on a blood thinner. Carry a list of medications in your pocket or your wallet, highlighting that you are on a blood thinner. There are also identification cards or jewelry, such as bracelets, that do highlight patients are on blood thinners. And lastly, ask a lot of questions and be your own advocate for your health. What is life like after a clot? Symptoms will typically improve within a few days of starting anticoagulant therapy. However, it is not uncommon for symptoms to eventually disappear over several weeks to months, since it takes the body this amount of time to naturally absorb the clot. Most patients will completely recover within a few months after the clot, without significant complications or long-term effects. However, about half of patients with a DVT will have some degree of chronic discomfort or pain, and about 15% of patients will experience moderate or severe chronic pain and swelling called post-thrombotic syndrome. Post-thrombotic syndrome is partly caused by both the damage done by the clot and then the scar tissue. It can cause swelling, discomfort, pain, aching, dark skin pigmentation, hardening of the skin, or skin ulcers. Elastic graduate compression stockings that can be special ordered for your leg size may help your leg feel better and help with the swelling. It is normal to feel shock, anxiety, and fear after the diagnosis of a blood clot. After dealing with the initial physical pain of the clot, there is the feeling of trying to understand why it happened, adjusting to the impact of being on an anticoagulant medication, and fearing that another clot may occur. Feelings of anxiety or depression can occur within the first few weeks, and the anxiety about another clot occurring may be ongoing. Talk to your healthcare team. Ask your healthcare team about support groups that may be available in your area, or connect through social media and online.
My biggest concern about what my life would be like post-clot was that my life would never go back to the way it once was. I couldn't do the things I loved anymore, like run, go for a walk with my family and my dogs. Even doing everyday things like cooking dinner or laundry was hard for me. It hurt to stand, it hurt to sit, it hurt to take deep breaths. I was worried that I would never again be able to even walk around. I was worried that I would never be able to do the things I wanted to do, and I was worried that life as I knew it would never be the same.
At the end of 6 months, my doctor said, well, I think we'll keep you on this a little longer. Because he wanted to be careful, because he was concerned that I might be at risk with my previous cancer surgery and other things, that I might be at risk for blood clots. Well, what I did is I said, okay, I'm a little depressed. I thought I'd be off of this after 6 months, and but I can wait another 6 months. Long story short, it's now been about 4 or 5 years, and I'm still on Coumadin. And what I've discovered is that this is a chronic kind of situation, and I've resigned myself that I will be on Coumadin probably the rest of my life. Not happy about it, but you can live a fairly decent life being on Coumadin. You just have to be careful. So, it's something you learn to live with. It isn't my first choice, and there's a lot of anxiety, I think, particularly at the beginning as you go through this initial stuff, negotiating blood tests, cutting yourself, having that experience of seeing how you bleed more easily, the diet. All of this is stuff that forces you to make life adjustments. And life adjustments create a little stress, sometimes a little depression. But I can only say that I've worked it out. And, it's not the big deal that I made it out to be earlier.
If you are diagnosed with a blood clot, you need to get medical treatment right away, and in most cases it's very treatable.
My biggest piece of advice for patients who are diagnosed with a clot is to seek support and seek it early on. First, seek support from your medical team. Find doctors and physicians that understand what you're going through and advocate for you, your situation, and your feelings. Find a team that works for you. From there, I suggest that patients get involved with other patients because you're not alone in what you're going through. One of the first things I did after my blood clot diagnosis was visit the National Blood Clot Alliance website, where I started reading patient stories about other patients who had been through what I was going through. I found out pretty quickly I wasn't alone. From there, I created bloodclotrecovery.net because I wanted to help other people through the healing process that I was already going through. I created a safe space online where people could come and discuss their stories and discuss what they were going through and share insights and observations, fears, concerns. Now, in my career at the National Blood Clot Alliance, I help even more patients find that sense of community and find that support through our online social media sites and also our online support groups. There is support out there. Start looking for it early on from your providers, from peers, from connections that you can find, because you're not alone in what you're going through.
So the post-clot period has been, as I've described it, adjustments, but nothing that I haven't had to handle, and I've handled well, but nothing that I couldn't handle. And they've kind of receded, all of these adjustments have receded into my routine of life. It's just the way things are. If I think about the advice that I would give to anybody who's diagnosed with a blood clot, I would go, before the diagnosis, I would say look for the signs. They're all up on the NBCA and on other websites. Basically, the redness, the pain, the swelling, etc. By and large, I really, despite all the adjustments I've had to make, really do live a normal life. Able to do most of everything I want to do, just with taking a little care on certain things. But otherwise, life after blood clots really is fairly normal.